Hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us for the start of our fall series for coverage year 2024. Today's webinar is on determining households and income. My name is Allison Orris, and I'm the Health Projects Assistant at the Center on Budget and Policy Priorities. I'll be moderating today's webinar. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center on Budget and Policy Priorities is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes, and while we hope you will learn a lot, we are not able to offer continuing education credit for our webinars at this time. Here you can see the schedule of our webinars in our fall series. We've got a lot of content to share with you over the next 7 weeks. We'll cover households and income, eligibility for the premium tax credit, resolving data matching issues, eligibility and outreach and application issues for people who are immigrants, which we are splitting into 2 separate webinars this year, plan design and plan comparison strategies, the annual renewal process, and our popular Tying It All Together webinar at the end, where we come up with the most complex examples we can think of to help you understand how all of the concepts in the series fit together. Although we will still cover the same core concepts we always do, we've added new examples throughout the series and, of course, integrated updates as policies have changed. We're also pleased to once again host a webinar in Spanish that focuses on enrollment issues most relevant for people who are immigrants and people who live in mixed immigration status households. And we're excited to be celebrating 10 years of marketplace coverage. As a part of our series this year, at each webinar, we'll be highlighting veteran assisters from around the country. Automated captions have been enabled for this webinar. To view them, click on the More icon at the bottom of your screen, and there will be 3 dots first to see the closed caption. And you may also see the CC icon at the bottom of your screen as well to click on closed captioning. All participants are muted and in listen-only mode. Though if you'd like to ask a question, click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and we will pause for Q&A during the presentation. We may not be able to answer every question asked, but we will have a record of all of your questions and we'll use them as a guide for future resources and presentations. And of course, you can email your questions during and after the webinar to beyondthebasics@cbpp.org. After the webinar, we'll circulate the slides, a video recording of this presentation, and other resources, and we'll also post everything to the Beyond the Basics website. And just as a reminder, you won't be able to click on your screen to go to any of the links shared in the deck, but we've put a link to this. I will put a link to the slides in the chat where you can find all active links to everything shared today. Today's webinar will cover how to determine who is in the household for Medicaid and premium tax credit purposes, how to estimate household income, and how to put household and income together to determine eligibility for Medicaid or premium tax credit. Today's presenters are Jenny Sullivan and Allison Orris from the CBPP Health Team. We will pause about halfway through the webinar to take audience questions, and we should have time at the end of the presentation for a few more questions. First, I will turn it over to Jenny for our anniversary segment and to get us started.
Great. Thank you so much, ISAT, and good afternoon, everyone. We are excited to kick off the series today. As you might have noticed in our emails this summer, we wanted to do something special this fall to celebrate 10 years of marketplace coverage. Last year, if you're still doing like OE10, OE9, last year was technically OE10, but the very first open enrollment period for marketplace coverage started 10 years ago this fall in October 2013. So to celebrate, we asked you all to nominate some of the most seasoned, effective assisters in your world for us to feature on our webinars this fall. And you definitely delivered. We had so much fun this summer reading about these wonderful sources of light in all of your communities. So thank you for sharing. Each of the individuals that you'll hear about at the outset of our fall webinars will be getting their very own Beyond the Basics tumbler mug as a small token of gratitude for all you've done to help people connect to coverage over the past decade. Our first honoree today is Anel Trevino, who was nominated by her colleague Juan Gonzalez at the Bexar County Community Health Collaborative in Texas. Anel is a navigator who has been doing this work for 12 years. In his nomination, Juan said that Anel's passion for wanting to help the community is unmatched. She's emotional, strong, and passionate about her convictions. She will go out of her way to give each person she helps the attention, respect, and dignity they deserve. So we asked Anel also for some advice to share with other assisters, and she said, maintain a deep understanding of your audience, demonstrate a passion for consumer education, embrace continuous learning. That's why you're all here today, so that's great. And prioritize ongoing relationships. Regular follow-ups, active listening, and building trust are crucial for providing tailored coverage to consumers who may be new to health insurance. So those are excellent words of wisdom to kick us off today. Thank you so much for your service to your community, Anel, and thank you, Juan, for nominating her. So now let's move on to the next slide and to our feature presentation for today. So why do household size and income matter so much that we're willing to feature a whole hour of content on them? It's important to understand how household and income are defined for purposes of Medicaid and premium tax credit eligibility, because these are the core building blocks for determining who gets what kind of assistance. And I will note that our application screenshots throughout this presentation are drawn from healthcare.gov, and there may be some differences between the way a state-based marketplace does these processes and the way they're done in states that use healthcare.gov, but the overarching policies and rules are universal across states. So sticking here on slide 7, remember, the online application is going to do all the hard work of determining what help a person qualifies for, and most of you probably know that by now. But understanding how the information that you put in the application affects the outcome is going to help you explain why you need to ask the questions you do, some of which may seem curious to somebody if they're applying for the first time, like why do you need to know my marital status, for example. And it's also going to help you ensure that someone lands where they're supposed to. The system doesn't typically mess up, but depending on how you ask the questions and how a person understands them, you might get to different outcomes. But the more you understand about what's behind those questions, the more likely you are to help the person get exactly where they belong the first time. So first, the application will determine Medicaid or Children's Health Insurance Program, or CHIP, eligibility. Adults in Medicaid expansion states are eligible for Medicaid with income up to 138% of the poverty level. In non-expansion states, adult eligibility thresholds vary, but of course are much lower and typically limited to adults who care for a dependent child. Children up to age 18 and pregnant people have higher income eligibility thresholds in Medicaid. If someone's not eligible for Medicaid, the application will determine their eligibility for a premium tax credit, or PTC, I may call it throughout today's presentation. To be eligible for a PTC, someone has to have income above the poverty line. And you can see the updated dollar amounts that will be used for 2024 on the slide here. In addition to income, the applicant also has to have an eligible tax filing status and not be eligible for another form of minimum essential coverage, like job-based coverage. And we're going to talk more about the premium tax credit at length and in depth at our dedicated webinar about it on Thursday, but these are just some basic concepts to keep in mind for now. Next slide. So here's a more detailed look at the federal poverty guidelines and income equivalent for 2024. Household size and income obviously are these key building blocks that we need. We need these two pieces of information to determine someone's income as a percentage of the federal poverty level, and then determine what form of coverage they may be eligible for and what form of financial assistance. PTC eligibility is based on the federal poverty guidelines in place at the start of the annual open enrollment period. So the ones you're looking at now are the 2023 federal poverty guidelines, because those are the ones that will be in place when open enrollment begins. This is different than Medicaid, which uses the federal poverty guidelines that are in place at the time the person applies for Medicaid. They typically get updated at the very beginning of the calendar year. And so at that time, Medicaid diverges a bit from what the marketplace uses. But fortunately, during the open enrollment period, both programs use the same guidelines. I'll also note here that each individual in a household gets their own eligibility determination. This can mean that parents and kids in the same household are eligible for different programs, and this is actually often the case because children's eligibility for Medicaid and CHIP is typically so much higher than it is for adults. Next slide. So once we know a household's income in terms of the federal poverty level, we can determine what their expected premium contribution is. That information, combined with information about the plans available on the marketplace where the family lives, is used to determine the size of their premium tax credit. Now, since the 2021 coverage year, the expected contribution has been lower because of changes made by the American Rescue Plan Act and extended by the Inflation Reduction Act. People with income up to 150% of the poverty line can get a benchmark plan, and we'll talk more about what benchmark plans are on Thursday as well, without having to pay anything for the monthly premium. And people with income above 400% of the poverty line, who in the past wouldn't have qualified for any tax credit, can actually get a credit if their premium for a benchmark plan would cost more than 8.5% of their income. Next slide. So fortunately, these and lots of other numbers that come into play when we're talking about marketplace eligibility are not things you need to memorize. You don't need to write them down today or really ever. We have a handy reference guide here that we update every year with all of this information in one place. This includes federal poverty levels for this year and for last year, expected premium contributions by income, employer coverage affordability thresholds, out-of-pocket maximums, tax filing thresholds, and the repayment caps for the PTC. Next slide. Okay, why tax filing status matters. So now we're going to talk about why this is important. And the thing to keep in mind is that you don't need to be a tax expert, but having some basic knowledge is pretty important to helping people out with their application. Next slide. Okay. So tax filing status is important because one of the first questions on the application is the applicant's marital status, either single or married. Now, this is pretty straightforward for most tax filers, but it's important to know the different options and how they affect PTC eligibility. Some people who are married should actually say that they're single in order to get the appropriate tax credit that they are rightfully qualified for. And some people who will say they're single may actually qualify as married. So let's look at each of these definitions. Someone who's single must be unmarried. They could be divorced, but they can't currently be married. And this does not include people who are married but living separately from their spouse. If they're married, they can't be counted as single. Married filing jointly is someone who's legally married and files taxes with their spouse. Again, regardless of whether they're living together or apart. Married filing separately is someone who's legally married but files taxes separately from their spouse, again, regardless of whether they're living together. People who are married or who file married filing separately are not eligible for a premium tax credit. So that is very important to keep in mind and an important thing to talk with your clients about as you're assessing their potential eligibility. And then finally, we have head of household. This is someone typically who is unmarried or considered unmarried for tax purposes, who pays more than half the cost of keeping up the home for a person or people who qualify as their dependents. Next slide. So as I alluded to on the previous slide, a person who is married has to generally file a joint tax return to qualify for premium tax credits. But there are 3 exceptions to this requirement. Somebody who is head of household, and somebody and people who are victims of domestic abuse or who are an abandoned spouse. these people do not have to file jointly with their spouse to qualify for a premium tax credit. Also be aware that some immigrants who file Form 1040-NR, which stands for non-resident, are not permitted to file taxes jointly, and as a result, they may not be eligible for the PTC. And that's not necessarily because of their immigration status. It has to do with restrictions, again, on their tax filing status. It's also important to remember that even though someone who files married filing separately cannot qualify for a PTC, they may still be eligible to enroll in Medicaid or to purchase full cost coverage through the marketplace. Next slide. So getting back to those exceptions, let's talk a little bit more about head of household. Here you can see the requirements for when a married person can file as head of household. This is typically somebody who, typically a head of household is somebody who is unmarried with kids, but if a person is married, there are also certain criteria that if they meet, they can be considered head of household. So those include, or those are, will you file taxes separately from your spouse? Will you live apart from your spouse for at least half the year? Will you pay more than half of the cost of keeping up your home? Do you have dependents who live with you for more than half of the year? And are you eligible to claim them as dependents on your tax return? And if you can answer yes to all of these questions, then you can file as, and you can say that you are going to file as head of household. Next slide. So here, I know it's a little bit fuzzy, probably the version you're looking at, but these are the sequence of questions that healthcare.gov asks to determine whether somebody could appropriately file as head of household. These have been on the application for a couple of years now. And they can be a bit tedious to work through because you have to describe where each person in the household lives, and they may have separate addresses and you need to enter those separate addresses, but this helps build out the household and understand, and it helps the application understand who's living under which roof in order to build out the appropriate households, both for Medicaid and for the marketplace. Next slide. So then let's talk about the other two exceptions I mentioned to the married filing jointly requirement, victims of domestic abuse and abandoned spouses. Victims of domestic abuse who live apart from their spouse in 2024 and who will be unable to file a joint return due to this can select single as their tax filing status, even though they are currently legally married. And the same is true for people who live apart from their spouse and are unable to locate them after reasonable diligence. These people should also choose single as their tax filing status, even though they're married. Now, this isn't common, but you will occasionally come across it, so it's good to understand how these rules work. You will note here, we've got the help text that comes up on healthcare.gov, and this can just be reassuring to folks because the idea of saying that you are single, if you are not single, is maybe not a comfortable thing to put into an application where you are saying under penalty of perjury that everything you've put is correct. But you can see in the help text here some reassurance that in these exceptional circumstances, it is okay to say single, even though you may legally be married. One other thing I'll note is that these exceptions can only be used for 3 consecutive years. Next slide. So now let's talk about determining household for premium tax credits. We talked about tax filing status. Now, how do we figure out who's in the household? Next slide. So for premium tax credits, it's actually pretty straightforward. The household includes everyone who is expected to be on the household's tax return for the coming year. So this includes the taxpayer, their spouse, and any tax dependents. These are people included in the household, even if they're not enrolling in marketplace coverage. You still need to build out the whole household so the application has a picture of everybody who is living in that household. Next slide. So who is a tax dependent? The application is going to ask questions, or is going to ask if the applicant has any dependents. So you have to know how to help the person respond to this question. And again, in some cases, it's going to be absolutely obvious and clear. They have, children under the age of 18, they live with them. Okay, clearly that's a dependent. But technically, it's important to understand the definition here. So a tax dependent can either be a child or a qualifying relative. A qualifying child does not need to be the biological or even the adopted child of a tax filer. They can be other family members as well. They have to be, the criteria that define a qualifying child are that they have to be a US resident or a resident of Canada or Mexico. They have to live with the tax filer for more than half the year. They have to be under age 19 at the end of the year, or under age 24 if they're a full-time student, or they can be any age if they're disabled. And they can't provide more than half of their own support. They meet all of those criteria, they're a qualifying child. Next slide. There we go. So one situation that you will likely encounter is how to count children of divorced or separated parents. The parent who claims the child as a tax dependent is the one who has to claim the premium tax credit for the child. Now, usually this is the custodial parent, and this is true even if the non-custodial parent is the one legally responsible for insuring the child. But there is an exception. If the custodial parent completes a tax form stating that the non-custodial parent will claim the child as a dependent on their taxes, then the non-custodial parent will also claim the premium tax credit for the child. And this can sometimes be a part of divorce settlements. So once you learn that this is potentially a factor in the household, you want to ask some questions to understand exactly what arrangements have been made. Next slide. So that's qualifying children. Now let's talk about qualifying relatives. This is a broad group that can include relatives as well as full-time members of a tax filer's household who are not relatives. The criteria for claiming somebody as a qualifying relative is very strict. They can't be claimed as a qualifying child, number one. They must live in the US, Canada, or Mexico. They must receive more than half their support from the tax filer. They must be related to the tax filer or live in the tax filer's home all year. And they must have gross income less than $4,700 in 2023. That threshold does change annually. Next slide. So let's walk through a couple scenarios of what that means. Here we have Anya. Anya is 22 years old. She's a part-time student with a work-study job where she makes about $4,000 a year. She lives with her parents, and the question is, can her parents claim her as a qualifying child? So we'll run this scenario through the criteria for being claimed as a qualifying child. Number one, she is a citizen. She lives with her parents all year long. But what about her age? She's 22, and although she's a student, she's only going to school part-time, not full-time, so she's too old to be considered a qualifying child. Go ahead and hit next slide there. So go back one. There we go. So you can see that while she meets the first, second, and fourth criteria, she doesn't meet the age criteria, so she can't be considered a qualifying child. Next slide. So now we're going to ask, what about a qualifying relative? Again, we go through all of these questions, and we know that she's not a qualifying child. She is a citizen. She gets more than half her support from her parents. She lives with them year-round, and her work-study job doesn't provide more than the $4,700 income limit. And so, next slide, we've met all 5 criteria, which means yes, she can be claimed as a qualifying relative, and her parents can count her as a dependent on their marketplace application. Now remember, the application is going to ask simple questions, but there's a reason, there's a method to the madness and a reason that they're asking all of these interesting intricacies of how a household is related. So let's go to the next slide. Let's go through a different example, this time a multi-generational household, something else you are pretty likely to come across. So in this case, the tax filer is Amy, who lives with her young daughter, Sabrina, and then her mom, Helen. Helen takes care of Sabrina, but she doesn't have any formal income. And the question is, can Amy claim Helen as a tax dependent? So we need to go through those 5 criteria again. Number one is pretty clear. She's not a qualifying child. And we know she is a citizen. She gets more than half her support from Amy. She lives with Amy year-round, and her income is 0, so it's below the limit. Next slide. So since she meets all 5 conditions for qualifying relatives, Amy can claim her as a dependent on her taxes. So these are the core concepts you need to know about household composition for premium tax credits, but the rules are different, quite different, when it comes to Medicaid. So I'm going to turn it over to my colleague Allison now to talk more about household composition rules for Medicaid and CHIP.
Great.
Thanks, Jenny, and hi, everybody. So I'm going to talk a little bit more about the rules, as Jenny said, for MAGI Medicaid cases. MAGI, as you know, stands for Modified Adjusted Gross Income. And the MAGI rules count only income, not assets. Now, there's some variation when considering households and eligibility for Medicaid relative to the marketplace rules that Jenny just went through. In Medicaid, each individual in a household is going to get their own individual income determination, and people in the same household can have different incomes as a result of that methodology. And understanding these rules is important if you want to screen people before they submit an application. You may have a sense that somebody is eligible for Medicaid and they could go straight to the Medicaid application. But let's go through the rules. Let's go to the next slide. We talk a lot about MAGI Medicaid, but not everyone's eligibility is determined by the MAGI rules. MAGI rules apply to children, pregnant women, parents and caretaker relatives, and to adults in Medicaid expansion states. This is in contrast to other rules, which are often referred to as the non-MAGI rules, that apply to seniors and people with disabilities. It's important to know that there are different household and income counting rules that apply if you're dealing with seniors and people with disabilities. States do have a lot more flexibility with respect to the non-MAGI rules, but we're going to focus today on the MAGI rules. So let's go to the next slide. Medicaid and CHIP households are determined based on a person's family and tax relationships, as well as their living arrangements. How people file their taxes or plan to file their taxes and who is in their tax unit doesn't always determine who is in their Medicaid household, but it determines which Medicaid household rules apply in defining that household. You'll see we've used some color coding on this slide and the following slides to bucket out those different types of tax filing scenarios. There are three categories of individuals that people will fall into, and then that will determine the rules that we use to determine their household size. The first category is the most straightforward. Tax filers not claimed as a tax dependent. This would typically be parents or other adults that are a head of household. Second, we have tax dependents. This can be somewhat straightforward, but there are three important exceptions that complicate this category, and I'll get into those exceptions in a minute. The third group is non-filers not claimed as a tax dependent. Some of these rules revert to more traditional Medicaid household rules. And again, going through all of this, what's important to remember is that there's a separate determination for each individual in the Medicaid household. Medicaid will look at the individual and who is in the individual's household, and then bring in the income of the people in the household. So that again means that even if people live together, even if they're related, they may have different household sizes. And also, just a reminder, as you can see at the bottom of this slide, this is all based on expected tax filing status, not what somebody filed last year, but what they expect to file this year. So let's go to the next slide. I'm going to talk a little bit more about the details of each group. And you can see that this is a document that exists on our Beyond the Basics website. You can get a PDF version of this to help you as you're working with families. So the red column shows the tax filer. The household here is the tax filer and all of the people who the taxpayer expects to claim as a dependent. For example, if you have an adult and two kids, and if the adult files taxes, the adult household will be themselves and the people that they claim as their dependent, those two kids. The next column, the tax dependent in orange, if you're claimed as a tax dependent on somebody's tax return, then your household is the same household as the tax filer claiming you as a dependent. This kind of mirrors the tax filing rules, but this can get complicated because there are three exceptions to the tax dependent rule. First, if the tax dependent for tax filing purposes is not a child of the taxpayer. For example, there might be an older adult living with an adult child, then the adult child doesn't follow the typical rules that apply to minor children. Individuals living under 19 with both parents, but the parents are not expected to file a joint return. That would be a second exception. And third, we have individuals under 19 claimed as a tax dependent by non-custodial parents. You could have here a child living with one parent, but a different parent is claiming them on their taxes. So if a child, including an adult child, falls into one of those three exceptions, then we move on to a third set of rules, those non-filer, non-dependent rules that are listed in the green column. And there are different rules for individuals age 19 and above, and those who are under age 19, just based on what their family scenarios might look like. And I can see that we have put the link to this document into the chat, so hopefully that is a helpful cheat sheet for all of you. I'll also direct your attention to the footnotes, which I'm not going to go through now, but are going to be relevant in some of the examples we've got coming up. Let's go to the next slide. Here's another tool that you can use. We know that these rules are complicated. This is a flow chart that helps to walk through everything. Here you start by asking if the individual expects to file taxes and if they're going to be claimed as a dependent on another person's tax returns. Those questions will then route you through the various considerations here. Some households, as Jenny said, are very straightforward. This chart can help you with more complex scenarios. And again, this is available on our website. So let's get to some examples on the next slide. Okay, so in this example, we're going to consider a household with a pregnant dependent. Nina, Daniel, and Emily all live together. Daniel is Nina's 4-year-old son. Nina's sister, Emily, who we're going to assume is over 19, is Nina's tax dependent, and Emily is pregnant. So we're going to use the tax filer rules for Nina, but this example has a twist, and Nina's household size could vary depending on what state she lives in. So we'll count Nina plus the 2 people she lists as dependents on her tax return, Daniel and Emily. Her household is therefore at least 3 people. But the twist is that when determining the family size of individuals who have a pregnant person in their household, states have the option to count that pregnant person as either 1 or 2 people, or the pregnant person plus the number of children expected to be delivered. So in states that have taken up this option, Nina's household size could actually be 4, counting Nina and Daniel and then Emily as 2. And this is one of the items that's reflected in footnote 4 on slide 31. So we wanted to just call your attention to that kind of variation where the state rules may matter. Let's go to the next slide. Daniel will be claimed as Nina's dependent, so his household size is the same as hers using the tax dependent rules. That means that it's either 3 or 4, again, depending on how the state counts the pregnant person in their household. And then if we go to the next slide, Emily's household is determined by one of the exceptions to the general rules because Emily is not a child of the taxpayer, even though she is claimed as a dependent. Emily is Nina's tax dependent, but she is not Nina's child or spouse. Therefore, she's again treated as a non-filer. And as a non-filer, and assuming she's over 19, Emily's household includes herself and her spouse or her children under age 19 who are living with her. But we've decided Emily is not married and she doesn't have any children, but because she is pregnant, her household size is 2. That rule always applies. It's not a state option for the individual who is pregnant. Daniel is not Emily's child and therefore does not count in her household size. So again, Emily's household size is 2. Now let's go to the next slide and we'll do a more simple example this time. We've got a child with non-married parents. Rob and Sally live together with their child, Bradley. Rob and Sally both have income, and on their tax returns, Rob will claim Bradley and Sally will file on his own. So Rob and Sally will fall under the tax filer rules for purposes of the Medicaid household. The household includes the tax filer and the spouse or dependent on their tax return. That's the basic rule. Here, Rob is filing taxes and he's claiming Bradley on his tax return. So his household for Medicaid purposes is 2. Sally is also a filer, but she's filing alone. And so her household size for Medicaid purposes is only 1. If we go to the next slide and talk quickly about Bradley, he is a tax dependent, but he falls into one of the exceptions in that green column. He's a child living with both parents who don't expect to file their taxes together. Using the non-filer rules as they apply to people under the age of 19, we count Bradley as well as their parents and any siblings. So for Bradley, we are at a household size of 3. And that, I think, brings us to the end of my examples and a moment for questions.
Yes, thank you, Allison and Jenny. Very helpful information in the first half. So we're going to take a minute to answer some really good questions. So first, can or should states make any adjustments to the 3 Medicaid MAGI rules that you noted, Allison?
That is a good question. And, I think that gets to some of the footnotes that I flagged. Married couples who live together are always counted in each other's household, regardless of whether they file a joint or separate return. So that is something that you'll want to be watching out for. And then family size adjustments may need to be made if the individual is pregnant. Thinking about, again, what the individual state rules are with respect to how to count a pregnant person who lives in a household with other people when you're determining the household size of those other individuals.
Thank you. And another question is documentation needed to verify that a person is a victim of domestic violence or spousal abandonment?
No, the marketplace does not require a person to provide verification for either of these circumstances. Remember, the overall premise of the application is that you're providing information about yourself and your household, or sort of swearing, attesting under penalty of perjury that everything you have said is correct. And this is one of those things that the marketplace is going to accept the applicant's attestation of without further verification.
Thank you. And just another question is a married person who lives with a spouse eligible to file as a single person in order to get a tax credit?
Be interested to know about the circumstances where that would be something someone was interested in, but the answer is no. A person who is legally married has to file married filing jointly or qualify as head of household in order to qualify for a PTC. If they're married filing separately, they're not going to qualify for a PTC. And if they are married, these are the only tax filing options. So both spouses don't have to enroll in the marketplace. So you can put on the application that you are married and you're going to file jointly, but only one person in the household is interested in getting a determination of marketplace and PTC eligibility, but you can't change your status just to qualify.
Another question is, what is the difference between using the state Medicaid application and applying through the healthcare.gov application?
Allison, do you want to start, or I can start?
Sure. So if an individual if you use the state Medicaid application, and you suspect that somebody may be Medicaid eligible, the state will determine them eligible for Medicaid if they are indeed eligible for Medicaid, and should transfer somebody to the marketplace if they are not. We know that those transitions don't always work very well, but somebody, arguably could get Medicaid more quickly than if they apply through healthcare.gov and need to go in the other direction. But we are living in a world where there should be a no wrong door system. That no wrong door doesn't always work quite as well, which is why in some cases you might want to screen people for eligibility before deciding which pathway to use.
And I would just add to that, that's absolutely right. And if you find yourself dealing with a person who has recently lost Medicaid or CHIP, but based on what they're telling you, it sounds like they're probably still eligible, which is a pretty common occurrence right now, given the high rate of procedural terminations in Medicaid due to what we call Medicaid unwinding. For people in that situation, you definitely want to work with them to go back to their Medicaid or CHIP agency to either get reinstated for coverage or reapply if it seems like that is very likely where they belong. For a person in that situation, you do not want to send them through the healthcare.gov application. It's not going to get them where they're going very efficiently or where they need to go.
Thank you both for answering all of those questions. We're going to continue on with the session, but there will be opportunity for a Q&A before we wrap up.
Okay, wonderful. So what counts as income for premium tax credit and for Medicaid? Next slide. So we've already talked a little bit about MAGI, modified adjusted gross income. This is the income used to determine eligibility for PTCs and for many Medicaid categories, including adults, children, and pregnant people. So what you can see on this slide is the simple formula for calculating MAGI, which is that first you take someone's adjusted gross income, which comes from the tax return and is the sum of all of their sources of income. Then you add any non-taxable Social Security benefits, which most people won't have, but some might. Only a portion of Social Security benefits are taxable, so we're just bringing in the other portion. Then you add any tax-exempt interest and excluded foreign income, although these are not categories that often have any income in them for most people. But if they do, then we need to bring those in as well to comprise their modified adjusted gross income. Next slide. So some general rules about counting income. So when you're asking somebody about income, keep in mind that all income is taxable unless it's specifically excluded by law from taxation. So you need to go in with the assumption that any income they mention is taxable unless you have a specific reason that it isn't. You've got some examples here on the slide. I'm not going to read through them, but we've got an in-depth guide listed up here in the corner that also gets into some of these issues in more detail. The other things to keep in mind, though, are that pre-tax deductions like retirement contributions are not included in MAGI. They're not included in wages, so we're setting them aside for now. And alimony is not counted as income by either spouse anymore. That was a change in 2019, but from now or from then forward, we're not counting alimony as income. Next slide. And then just to really underscore this idea, people may have qualifications about what their income is. They haven't declared it in the past. It's on the side. It's not their main job. If it might be cash. It's all taxable. We need to include it when we're building their modified adjusted gross income to get to the appropriate determination of marketplace eligibility. Next slide. But what you will come across is, in many cases, is people with self-employment income. And this can be hard to project when you're looking at projecting income for the coming year. So you might have to help the person build their projected income based on anticipated jobs they think are coming up, comparing their income to the prior year, looking at invoices, receipts, bank records, that kind of thing. You need to kind of get creative and really build out the vision for what the year is going to hold to get to their self-employment income. And then once you have all of that income, of course, for self-employment, we deduct any job-related expenses. This can be a little confusing too if the person is doing it for the first time, but you've got a list of common expenses here, and rent and repair of equipment are often the biggest expenses. Next slide. We also have a tool, which again, you can link to in your version of the slides, but this is just a way to build out for somebody what we're including in their anticipated income as well as their anticipated expenses. There's multiple pages to this guide. And then the good news is that you can then fill this out and send it home with the person so that 6 months from now, if things change a lot, they can go back and jog their memory and say, okay, well, this is what I put on my application and things have changed, so I need to go back and report a change. Or actually, this is what we anticipated, so I'm all good. It's a nice record of the conversation you've had with them and what you've put in the application. Next slide. So then after you have entered the tax filer's income, you need to enter any dependent's income. MAGI includes not just the tax filer's income, but the dependent's income as well, if the dependent is required to file a tax return. And figuring out whether they're required to file a tax return is a complicated calculation, which you don't have to worry about making, but you do need to put their income into the application, and then the application will determine, based on all of its inputs, whether it needs to count that income or not. Next slide. So let's look at a quick example on this. This is Jill and her son Ryan, who is her tax dependent. Jill's annual income is $35,000. Ryan has an income of about $4,000 a year from his part-time job. So whose income is counted for premium tax credit purposes? Next slide. Okay, so we know Jill's income is included because she's a tax filer. Ryan's income is not counted because it's so low, but we're going to enter both of their incomes into the application anyway, and healthcare.gov will sort it out. If Ryan's income happened to be higher, if it was, for example, above the tax filing threshold, then it would be less clear, and the application would calculate which circumstances to include it and when to continue to exclude it. It's rare that a dependent's income is included, but the system is going to sort this out for you. Next slide. So now we need to talk about annual versus monthly income counting. Medicaid eligibility is based on monthly income, while PTC eligibility is based on annual income. Next slide. So we start in the application by entering monthly income. It's going to ask about both, but we start with monthly. So you'll enter the type of income, the employer, and then how often the person gets paid. And then if you select hourly from that last drop-down menu about how often they get paid, then you'll get another box that asks how many hours they work per period. Next slide. Now, after you've entered monthly income, the application is going to multiply that by 12 to generate an estimated annual income. And it will say, does this look like the right income for you? But this is not going to be accurate for a lot of people. For example, seasonal workers, people who have variable schedules, people who have a different sort of monthly pattern to their hours or wages, that sort of thing. So when the application asks, does this look correct? You're going to say no, and then you'll have a chance to describe the projected annual income more precisely. Now, what you should not do is go back to the previous screen and change the monthly estimate so that it's 1/12 of the annual estimate so that you can sort of skip past this question. The application needs both independent inputs in order to figure out Medicaid and marketplace eligibility. But if you say, yes, the income, so then you describe the annual income more precisely, and the marketplace is going to give you this option in the blue box to use a couple of different tools to build out different sources of income and how often the person gets them, to get a really crystal clear snapshot to the best of our ability of what their projected household income is. Next slide. And the first tool is really great. Highly recommend it, this annual income calculator. You're going to enter, much like you did to build the monthly income, you'll enter the type of income, the amount, how often the person gets it, which months they get it. Maybe it's, unemployment income and they're only getting it for certain months, and then we know it's ending, and sort of start and end dates for different things. And then what it does is generate this nice, simple to read PDF version of their expected net income for the coming year. And this is fabulous. You can save it, you can print it off. And again, then that person has that record. This is what I put in the application, and this is how we got there, so that as circumstances change throughout the year, as they so often do, they know whether to go back and report a change on their application to get a new determination if things are really changing with their income a lot. And projecting what happens in the future is hard for anybody. So this is a great tool to capture what you enter at the time of application. Next slide. Okay, quick example here to demonstrate what the gap filling rule is. So usually using monthly income for Medicaid and annual income for PTCs results in a single definitive eligibility determination. But there are times when someone might be determined eligible for neither because of the way these rules work. And there is a rule to account for these situations. So to build this out, the example is Leah. Leah lives in a Medicaid expansion state and she lives alone. She starts a seasonal job as a cashier at the mall. And in November, she applies for coverage and attests to her current monthly income being $1,800 a month, which is about 148% of the poverty level, but predicts her 2024 income will be $12,000, which is only about 82% of the poverty level. So her monthly income looks too high for Medicaid because of that seasonal job, but then the application will look at whether she's eligible for a premium tax credit, and the answer here would also be no, because her annual income is below the poverty line. So the gap filling rule kicks in, which says that in situations like this, Medicaid eligibility is determined using the marketplace household and income counting rules. So that means we use annual income. And based on annual income, Leah is eligible for Medicaid because her income is 82% of the poverty level. And remember, the gap filling rule says to use the marketplace household and income counting rules. It does not say that the person is eligible for the marketplace. So just try and keep that distinction straight in your mind. Next slide. So once all the relevant information has been entered in the application, healthcare.gov makes a preliminary Medicaid eligibility determination. But in most cases, the case is then sent to the state for a final determination. The Medicaid agency might agree that the person is Medicaid eligible, or they might determine that the person's ineligible and send them back or send the application back to healthcare.gov. And when this happens, the marketplace will send the person a notice saying, come back, resubmit your application to the marketplace. As Allison mentioned before, these transfers back and forth between agencies take time, and it would not be unusual for the open enrollment period to have ended by the time a person gets this notice to come back to the marketplace. But, and we know this is especially true this year because Medicaid agencies have some pretty significant backlogs because they're dealing with redeterminations for their entire caseload. So when the person updates their application, they will be asked if they were recently determined ineligible for Medicaid or CHIP. And they'll answer yes, because that's what happened. And this will trigger a 60-day special enrollment period for marketplace coverage. The example here is of the notice is from 2022, but we expect the 2024 version to be similar. Okay, next slide. We're going to go through a couple more examples and then hopefully have a little bit more time for questions. Next slide. So quick commercial break on estimating income. You may already have other tools to do this, but this is just a reminder that healthcare.gov has their See Plans and Prices tool, and state-based marketplaces have a similar tool. You can look up those tools by using the links at the top of the page, so that you can play around with someone's household and income and get a ballpark estimate of what we think their premium tax credit will be, or whether we think they might actually be eligible for Medicaid or CHIP. And this is sometimes really helpful to do at the outset of the conversation with somebody, again, so you all have a clear sense of where you're headed. Okay, next slide. Let's revisit our 3-generation household from before. This is Amy, Helen, and Sabrina. And since Helen is 62 years old, she is not eligible for Medicare. Sorry, we're gonna go through her household now and bring these rules together. I should have said to start. How do we apply Medicaid and premium tax credit rules? So first, we know that Helen is not eligible for Medicare, so we'll set that to the side. She's not old enough where that's going to come into play. And as a reminder, Amy is the tax filer, and she's claiming her daughter Sabrina, who's a qualifying child, as well as her mother, who's a qualifying relative, as dependents. So first, the application looks at Medicaid eligibility. And for that, Amy and Sabrina will have a household of 3 with Amy's income. Because remember, we're looking at monthly income for Medicaid. And to keep it simple, we'll assume Amy's income is steady throughout the year. So we'll take Amy's annual income of $40,800, divide it by 12 to get $3,400 a month, which equals 164% of poverty for a household of 3. Amy's not going to be eligible for Medicaid since her income is greater than 138% of poverty. However, we know that children's eligibility is much more generous. So with an income at that level, Sabrina will almost certainly be eligible for CHIP. For Medicaid eligibility, moving on to Helen, Helen is going to be a household of 1 for the reasons Allison outlined earlier. She's a dependent over age 19, and she doesn't live with a spouse or any minor dependents, so her household is just herself. Her monthly income is only her own earned income, which in this case is 0. Now moving to the next part of the table, looking at PTC eligibility, Amy still has a household of 3 and an annual projected income of 164% of poverty, so we can be reasonably confident that she'll be eligible for PTCs. When we look at Helen, we have to change her household size for calculating PTCs because she's part of Amy's household because she's Amy's dependent. So her income is the same as Amy's, 164% of poverty for a household of 3. Now, if they live in a state that's expanded Medicaid, we wouldn't be having this conversation because Helen would be eligible for Medicaid. But because, or if they live in a non-expansion state, Helen would be eligible for premium tax credits. Next slide. I know we're coming up to the end here, but hopefully we'll have time for a couple more questions. So let's revisit Rob, Sally, and Bradley. Rob and Sally, again, are not married, so they can't file jointly. And Rob's projected annual income for 2024 is $22,000. Sally's is $31,000. Rob claims Bradley on his taxes and will file as head of household. Sally will file as single. So starting out with Medicaid, Rob's household for Medicaid will be 2, himself and Bradley. So his income is 112% of poverty. His eligibility for Medicaid will depend on whether they live in an expansion state or not. Sally will be a household of 1. Her monthly income equates to about 213% of poverty, so she's not eligible for Medicaid. Her income is too high. Bradley will be in a household of 3, including both his parents, since we follow the non-filer rules for dependents who live with both parents who are not filing jointly. His income includes both parents' monthly income, which added together is about 200% of poverty, which means he's likely eligible for CHIP. So moving on to PTC eligibility, we'll scratch Bradley off the list since we know he's going to be CHIP eligible. Sally is still a household of 1 since she files as single. Her income of $31,000 a year is 213% of poverty, making her solidly premium tax credit eligible. For Rob, it depends. If he's in a state where he's Medicaid eligible, then he's done. But if he's in a non-expansion state, we'll look at PTC eligibility next. Again, his household size will be 2. His income will just be his own income, which means he would be eligible for a premium tax credit because it's above 100% of poverty, and he's not eligible for Medicaid. So as you can see, there's a mixture of PTC, Medicaid, and CHIP eligibility in the same household. Often, you will often come across this, and we haven't even accounted for offers of employer coverage. For today's purposes, we will assume no one had any offers of employer coverage, but that comes up a lot as well. It's not uncommon to have people with multiple coverage dispositions, and the application will help people get where they belong, but it's better as a navigator or another kind of assister that you know where the ship is headed and that you can help people get where they belong regardless. So with that, we have a few minutes for questions.
Yes, thank you, Jenny. Let's get into the questions. So first, when an application is sent to Medicaid from Marketplace and there is a gap in coverage while waiting for Medicaid determination, and by chance, if denied by Medicaid, is there coverage for the applicant during this time? And if so, is it Medicaid or Marketplace?
Okay, I can take this one. So if somebody applies for Marketplace coverage during open enrollment, but then they're sent back to Medicaid for a full determination, and then they're sent back to the Marketplace because they're not eligible for Medicaid after all, then they qualify for a 60-day special enrollment period. Their Marketplace coverage effective date, because at this point we've ascertained that that's probably where they belong, is in the Marketplace. Their effective date will be the 1st of the month following plan selection, but people in this situation can call the call center and request a retroactive start date back to the date that they would have gotten coverage if the Marketplace had originally determined them eligible for Marketplace coverage. So this requires a call to the call center, but it is well worth it to get somebody the months of coverage that they so desire if they want those retroactive months. They have to pay premiums for those retroactive months, but it's available to them.
Thank you. And we're just going to squeeze in one last question. I always get tripped up when I'm dealing with divorced couples where the non-custodial parent claims the child on their tax return. Can you go over that again?
Sure, I can start. And Allison, if you want to speak up here, please feel free. This is such a tricky issue and we get so many questions about it. And I think the best thing to do in these situations is really to build a table like the ones we've been showing you in some of these slides, where you run each person in the household through the household and income rules for Medicaid first, then for premium tax credits. And you can use that chart that Allison referenced and that was in the chat. The link was in the chat. The marketplace will apply the Medicaid rules first to rule out potential Medicaid eligibility. Then you'll follow the non-filer rules to build the dependent's household. So you're going to count the people the dependent lives with. But if the dependent's not eligible for Medicaid, then you move to premium tax credit rules, where they are included in the household of the non-custodial parent if the non-custodial parent is the one claiming them on the tax return. And you have to ask questions to figure out how this particular household has determined or has decided to handle who claims the child on the taxes. So it's not the same in every situation.
Okay, thank you so much, Jenny and Allison, for today's presentation. Here are the resources that that are linked in the slide deck with all active links. And as a reminder, we will distribute the materials from today's session via email and post everything to the Beyond the Basics website. Our next webinar is not too far away. It's the premium tax credit scheduled for Thursday, September 14th at 2 p.m. Eastern Time. You can register for this webinar and other upcoming webinars on the Beyond the Basics website under upcoming webinars. And you can also find reference charts, guides, and other resources on the website. If you have any questions or need assistance, please email us. As you can see here, and here's Jennifer and Allison's email. Thank you so much for joining. And with that, that will be all.